This is Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about the signs and symptoms of poor circulation in the feet and legs. Poor circulation, specifically circulation of the arteries which bring blood down into the foot and the legs, is a condition that is often underdiagnosed because of the fact that the symptoms of this condition are usually fairly subtle, and the symptoms that are seen most commonly often don't come about until the end of the process. Poor circulation is fairly dangerous to people in that if it gets severe enough, it can cause death of tissue in the foot and legs because this tissue is starving for oxygen nutrients that the blood would typically deliver. When there is a blockage of the artery, or if the arteries aren't functioning properly, these nutrients as well as the oxygen that the blood delivers does not get to the tissue, and they begin to die, and this can be a fairly painful process. The signs of poor circulation in the feet and legs are numerous. These can include things such as a reddish or purplish discoloration on the bottom of the feet or toes. It could also include a lack of foot hair or toe hair. Pulses also can be decreased, something which your physician can be able to tell, as well as thinning of the skin and a general cold feeling to the toes and to the foot. Oftentimes people will associate different types of symptoms with poor circulation, including a tingling or numbing sensation, such as when one has been seated in a cross-legged position or sitting down with pressure on their legs for quite some time. This is actually not poor circulation. What this is usually a compression of a nerve. So if there's a tingling or a pins and needles like sensation or a numbing sensation, that's not a sign of poor circulation. That's usually a sign of nerve compression, or sometimes even nerve disease if no compression has been applied to the nerve itself. People who are at risk for poor circulation to the feet or legs include people who have high blood pressure, who have diabetes, high cholesterol, are overweight, as well as people who have kidney disease and other types of conditions, which can indicate that there is a lack of blood flow going into various parts of the body, the legs being one of them. Poor circulation is easily treatable, and we have newer techniques in this day and age in which the arteries can be cleaned out without necessarily having to have a major surgery to bypass the artery and provide new blood vessels going past the point where the artery is blocked. However, early diagnosis is very important for this condition. If the condition is not diagnosed in time and surgery can't restore the circulation down to the feet and legs, people run the risk of developing gangrene as well as amputation of the foot or even of the leg itself. Diagnosis is fairly easy. There are some very non-invasive simple tests that can be performed that can tell what the circulation is doing and whether or not there is a decrease in the circulation pattern that needs to be monitored or treated. This can be done in a numerous specialist office, and the surgery is typically performed by a interventional cardiologist or by vascular surgeons. If you suspect that you may have poor circulation or there is a history of that in your family, it's very important to get screened and evaluated. Well, I hope you've enjoyed this video. Please look for more videos on foot and ankle problems on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.